Com. Now to the health care debate as Senate Republicans regroup after putting health care on hold for the holiday break. A new poll showing nearly 6 in 10 Americans do not like the current Senate bill, and even among Republicans, fewer than 4 in 10 are in favor of it. And with me now, Republican Congressman Francis Rooney of Florida. Representative, thanks for dropping by. I know it's a holiday weekend, but it's a topic that you know well here. You saw 4 in 10 Republicans at the moment supporting the current bill. That means 6 are not. What's your reflection on that?
Well, I hope that the Senate will get with the program and remember that they all ran on repealing and replacing Obamacare with something that is patient-centered and offers choice to American insurance buyers. They seem to be just caught up in all kinds of weeds here, with the Medicaid expansion. The Medicaid expansion, it needs this radical overhaul that the House bill put it in. It was supposed to be a state-centered program run by governors, accountable by state legislators that are closer to the people. I'm all for doing that.
As you know, when we look at the Senate bill, where there's a concern, as well as with the House bill, of Medicaid and Medicaid expansion, and how that might move forward. Don't you have some concern about that in either one of the versions of the bills?
No. If the way Medicaid was conceived, it was a majority funded by states, and President Obama shifted the equation to draw the federal government into it and to radically expand the kind of people that can get it. This is supposed to be a poverty program for people that are at the poverty level and can't afford insurance. If this thing works as hoped, the states can deal with their Medicaid populations the way they want with their own taxes, and we can focus on the affordable health care or Senate equivalent types of choice opportunities for insurance for people that don't have groups.
What about those states that can't afford it?
Well, they have to get their house in order. I mean, those are their people. They're not our people. If Florida wants to create jobs and have a lean budget and pay its bills on time and have a good credit rating and have one of the cheaper costs for Medicaid in the country and have that robust job growth and opportunity for its citizens, great. Why should we be paying for these profligate states like Illinois?
When you look at some states, they will need that assistance from the federal government. That was the idea, that if all states had taken in Medicare, that therefore the revenue and the cost structures would have balanced out. And what has caused this imbalance, if you will, is that because Medicare was built in to be adopted by all the states, and they have not, as you know, about half have not adopted this expansion, that has put it out of kilter in terms of costs being too high and revenue not being in place. Go ahead.
Well, the only way it was built in to be considered for all states is that's what the Obama administration originally wanted. I know most everybody I know didn't want any part of it.
Right. Certainly those on the right side were not in support of Obamacare as it was moving forward. In this case, you now have the opportunity to fix it. The question is, and it's been said by many of those who are watching the debate in D.C., are you ready to sit down? Are the Democrats ready to sit down as well? And they're saying, no, it's so far away. Both sides are so far away from each other to actually getting something done together. Chuck Schumer says, well, that's possible. Let's do sit down. Let's do figure out the tweaks.
I think Senator Schumer's a bit of a wolf in sheep's clothing on this. I'm hopeful that the majority leader and Senator Thune and Cornyn can come to some kind of way to bring people like Senator Heller along, and that Senator Lee and Cruz, who seem to be working behind the scenes to keep this a good conservative bill, will prevail.
The House bill, as you know, the numbers are above $20 million for both the House version as well as the Senate version of the Republican bills to try to repeal and replace Obamacare. How do you explain those numbers to constituents who question that of you?
I love to do it, okay? And I've said right here on your show several times, it's voodoo economics, the way the CBO scored that thing. The model's a static, statist model that doesn't give any credence to behavior modification through that tax credit program. It basically assumes that if you aren't mandated to buy, you won't buy insurance under the new program.
And are they responsive to that?
Yeah, most people seem to be getting it. The Wall Street Journal's been very responsible, writing a few articles about it. And they also point out how far off the CBO was last time when they said that there'd be 22 million people covered under the new program, and less than half of those were. They were off 125%.
We see the variations in any statistics, but when you're looking at 20, 22, 23, 32 million, and you take out those variations, we're still talking about millions of Americans that will not have insurance, Congressman.
Well, what Mark Twain used to say, figures don't lie, but liars figures. There's all kinds of figures going on around here. There's something called the Center for Health and Economics that scored the Better Way Health Program, which is pretty close to what the House passed. And it said we probably have 1 million more insureds in the first year and as many as 13 more insureds by 2026.
10 days, so the senators are going to be home. You've been through this before. They'll be debating with their constituents, their voters, those residents in their states, and they'll have to answer tough questions. You've heard some of that yourself, as well as seen it just within the last 24 hours. Where do you think this is going to end up here, Representative, once the Senate comes back after the 10-day break?
Boy, I don't know. Like I say, I know what I hope. But, this politics is a different line of work than business, where you have to take tough positions and back them with money and back them with people's careers. I hope that they realize that they faced the people that disagree, and it's not the whole country, that our half of the country wants this kind of reform, that we all ran on it. We've got to that they'll live up to the commitments that they made to the people that voted for them.
All right, thank you so much, Congressman Francis Rooney of Florida.
Thank you.
You bet. The threat of cuts to Medicaid has many Americans terrified of losing their health care, as we were just discussing with the representative. Scott and Adrienne Trigg are the parents of 8-year-old Hayden. He suffers from spina bifida, among other ailments. He has undergone numerous surgeries and requires a near daily regimen of drugs and therapy. And the family lives now in Texas, where they are already feeling the impact of state cuts to Medicaid. Joining me now is Adrienne and Scott Trigg and their son Hayden, and Rachel Hammond, the executive director of the Texas Association for Home Care and Hospice. And thank you all for being with me this hour. And let me start with this question first. And as executive director, and as you look at what the process is of Medicaid cuts, what are some of the impacts that are being felt by residents in your state?
So currently, many of the providers are suffering at this point, and so are the families who receive those services. The legislature passed a $350 million reduction to very critical services for children in 2015. And those reductions in funding for Medicaid has resulted in several businesses closing across the states, across the continuum, and thousands of children going without services.
Adrienne, what has that meant for you and your son Hayden?
Well, those state changes and cuts in Medicaid this year, we did have a delay of services. It quite honestly was meaning trips to the doctor's office because we had delays with his medical supplies, his basic needs that he needs every single day. We couldn't get medicine. We couldn't get catheters that he uses. He's had to wait 14 months for a wheelchair to come due to these cuts in Medicaid and shortfall in our state budget. So it was devastating to our family. We're very fortunate that he didn't end up in critical care in the hospital from those delays.
Scott, how did you talk to your son Hayden, who's on your lap right there? How did you explain these differences in services and how things were evolving?
Well, currently, Hayden's had 22 surgeries and 26 diagnoses, and he really loves his physical therapy and occupational therapy, and he loves his wheelchair, and it's a very important part of his life. And if we don't receive those services, we might have to choose to institutionalize him amongst other kids that receive Medicaid throughout the nation.
And Hayden, how you doing?
He's not mic'd up right now.
Okay.
He's a little sleepy, but he really loves his physical therapist, and that was something that he had to wait months to get reinstated. And so that really delays some of his progress that keeps him independent and attending school. So there were big ramifications for us where the legislation we had no recourse with.
It's great to have him here, though, with us for this conversation. Scott, you may have heard what the representative from Florida said. He does not represent a district in your state. But when you hear the responses from lawmakers about Medicaid, what's your reaction been, and have you been satisfied with the answers that you've heard?
I have not. I think, one thing is we pay for primary insurance, and I have a great job which allows me that great primary insurance, and I don't feel that this is helping our medically fragile kids amongst other children that need to receive Medicaid. I'm not satisfied with that answer.
And Adrienne, what do you want to tell lawmakers that do not have satisfactory answers for you?
I just believe that this is an ethical issue. This is not a political issue. We're not a football to be thrown around with. These are our children's lives. It is not, as the representative was saying, simply Medicaid is for the poor. This is something that is affecting our most vulnerable. This is definitely an ethical issue, not about tax breaks, not about health care. That's about ethics. With our child and with other families throughout the country that get diagnoses in utero, we are conservative and we chose life. And this will make a big stand on those families that get these diagnoses in utero, whether or not they abort their children or they choose to keep it, knowing that they have the safety net of Medicaid. This is very passionate to our family. It's a very personal story that we are very fortunate to have this national platform to tell. And we really hope that our legislators will look at us and just to be seen that this is who it affects. We're average Americans here that are working and not just poor and impoverished. And we're fortunate in the state of Texas that they have allowed us to do a waiver program that's not based on income but on disability. So he gets Medicaid based on as many disabilities that he has, and we don't have to live at an impoverished level.
Rachel, how many Hayden families are there out there right now, and what are we missing in this story? What is the topic we're not talking about enough?
Really, I think there's a fundamental misunderstanding of Medicaid and really who Medicaid serves. I think I heard from the speaker earlier that Medicaid is primarily for individuals who are poor or impoverished. However, as you see today, working families also have to have Medicaid because commercial insurance is so limited in the coverage that it provides for children with ongoing disabilities. And so these services such as physical, occupational, and speech therapy are critical to their ongoing development. And Medicaid provides the ability for children to receive those services. So as states face capitation, for instance, that's contemplated right now in the federal health care bill, they really are going to have to be creative in how they apply very limited funding. And right now the system is absolutely biased toward institutional care rather than services provided in the community, which are much more cost effective and obviously have a wonderful impact on children like Hayden.
Adrienne, quickly here, you're the mother, proud mother there of Hayden.
Yes.
And for those who are not listening, what's the sign you will be holding up so they can hear what you are thinking? Just what you will write on that sign.
I have a sign and it says protects Texas fragile children, but really it's to protect our Medicaid. This is life-saving. By cutting nursing and cutting any of the attendant care or the therapies, you are taking profit from our children's pain. And that's really what I want them to know. This profit is at the expense of our fragile and most vulnerable population.
Adrienne, Scott, Rachel, and Hayden, I know you can't hear me. Thank you so much. Excuse me, Trigg, I meant. Thank you all for being here with me today.
Thank you
Thank you so much.
We'll be right back.